that nobody could taken care of.
So should everybody have a parasite medicine then? You think everybody should take it?
I wouldn't say everybody, but by the time they come to see me for unexplainable medical symptoms, when they went to major medical institutions like a Mayo Clinic and Cleveland Clinic, or one of the major hospitals from St. Louis areas, or Mount Sinai, Mount Cedar, they miss parasite problem, they miss dental problems almost always. But I will not say everybody have a parasite problem.
Wow.
Does that make sense?
Oh, yeah.
Yeah.
Well, I mean, read the book, okay? Then you can, he may be a little hard. I bet you're sitting there going, what did he just say? That just makes you go to that website and get this book, okay? Because he says it in here clearly. You talk about the body's ability to heal is dependent on its internal environment.
Mm-hmm.
So explain that.
That's what we call biological terrain. The terrain is controlled by so many different factors, but the French doctor talk about Vincent talks about our body pH, how it's important to regulate our terrain, and what we call reduction oxidation potential. This basically we say, do you really need more antioxidant or not? You know, like a vitamin C, vitamin E, you know, vitamin A, all those spectrum of the antioxidant in our body to protect our body. And also measuring what we call electrical resistivity. They give you your body is congested or not in your liver, spleen, pancreas, etc. By those parameters, we can say, are you susceptible to infections and getting sick? That's the whole concept of the terrain. When our body is sick, then, I mean, our body is, the terrain is out of balance, then we're more susceptible to being sick for viral infections and streptococcal infections and whatever your problem is. And then it will manifest into symptoms as a pain, cough, pneumonia, you know, neurologic symptoms or whatever. Those are all symptoms. Then we give a diagnosis, that's a lupus, asthma, MS, Parkinson's, whatever. Then we use a medication to control those symptoms with the understanding why we have these problems.
Now, you even talk about chelation.
Yes.
Years ago, back in early 90s, maybe even in the 80s, I did a lot of shows on chelation therapy. And you know, they would kind of call some of my shows whack medicine. You know, it's like, you know, you don't buy that. But it's amazing how many people used chelation therapy. And one guy actually was going to have bypass. And so he watched a show back in the 90s, had chelation therapy, went back for another examination to see if he needed the bypass. He'd already been told, you need bypass. The guy looks at the x-ray, it actually happened, and he says, what have you been doing? And he goes, why? And he goes, there's no blockage. Talk about chelation.
There are many different chelating agents. The goal is to remove the heavy metals. And there are two main chelating agents I use. One is called EDTA, and they can remove the lead, but part of the side benefit is they can improve your cardiovascular function. The US Navy actually done the studies for those workers in the dark suffering from lead poisoning. And so they did a chelation therapy, EDTA chelation therapy for lead poisoning. And some people have actually chest pain and have a heart problem, and their chest pain goes away and their heart problem improved. So it was actually incidental finding. You may call it accidental. And so we've been using that EDTA for not only for lead poisoning and for cardiovascular problem. And lead poisoning is probably a lot more common than you may think.
From what?
From our environment, from when you're growing up, there's a lead gasoline, the paint with the lead, and that deposits in your bone when you're young, and then you recirculate in your body. So when you challenge your body, often we'll see that lead coming out of your urine. They will measure those. And the other important chelating agent that are used is called DMPS, called dimercaprolate propane sulfonic acid. And that's been around for over 60 years. Right after World War II, they developed in the United States and Russia to protect the public from nuclear fallout.
Oh, yeah.
And turned out to be, that was actually great for pulling the mercury out and also get the lead out. So when you measure using this kind of chelating agent for people with a lot of silver fillings, we'll see massive amounts of mercury coming out of their body, and also lead will come out because it's coming out of your bone.
That's amazing.
Now, you even, I was reading it here, I mean, it's thorough. A way to detox the body. You even have a whole article, pages on how to do that. Explain a little about detoxing.
We always start with the gut, because the gut is the main source of all the environmental exposure to it. So you have to make your gut move to have at least 2 bowel movements a day. Then you can get more advanced cleansing program, and I'm talking using herbs to get your bowel moved. Then you can do animal or coffee enema, colonics. You can do what we call gallbladder liver flush, where you drink apple juice, and then you'll be drinking the olive oil to purge your gallbladder, liver, and also for pancreas. They put a lot of stress. If your gallbladder and your liver doesn't function well with all the environmental toxins, then your pancreas gets in stress. So you have to clean them out.
Well, you talk about actual objects coming out.
Yes.
That you can see.
Oh, yeah. I have one patient who has a schedule to have gallbladder operation, and he stopped by in my clinic on the way to schedule for his gallbladder operation, gave him the instruction how to do it, and he came back 1 week later. He says he was able to cancel the gallbladder operation, and he said he passed actually size of the golf ball coming out of his bowel movement, and he was able to cancel that operation.
Wow.
And then you talk about the liver, a cleanse.
Yes.
Very important.
Oh, yeah, because we get all those chemical, environmental toxins we get exposed to. Over 6,000 chemicals that are floating right now in the environment, from the food, water. You cannot get away from this. So we have to have basic cleansing program all the time.
How often should you cleanse, like your liver, your pancreas, and all that?
For new patients, I tell at least once a month for gallbladder liver flush for 3 times to 6 times. That means we'll talk about 3 to 6 months.
When he was in the book, he was telling me how many times to do it. I'm going, wow.
Wow.
No, this sort of thing we
You
need to
do it?
Oh, absolutely.
Wow.
Especially when I travel, I have no control over what I'm eating.
Yeah, that's right.
And so when I come back, I usually do some form of a cleansing program, yes.
It's amazing in his book. I'm trying to get to it real quick. He has a whole list of food additives to avoid, and I mean, just amazing. You don't think that this is going into us?
Yeah, I know. And you talk about there's a case with a strawberry milkshake. I think Ed Schloss talking about it.
Now talk about that.
There's no real food in it. There's all those chemical ingredients to call it strawberry milkshake.
And we get the taste, but there's nothing there.
Right, there's no strawberry, there's no dairy products, there's nothing. It's all chemicals and sugar, all those additives.
Wow.
And then we have to, after enjoying all that, we have to get our body detoxed.
Yeah. Yeah, and so why we're getting sick, since young children are getting sick.
I know.
They're getting all those antibiotics, vaccinations, and while we are seeing autism, while we are seeing these young children developing diabetes and cancer is very rapidly rising. This is an epidemic problem that people have to be aware of, so we can prevent this phenomenon from getting any worse.
He even uses baking soda for a test. So it's in the book about how you can do that test. That's pretty simple.
Yeah.
And it gives you the results, and he can, in the book tells you what those results mean. Cholesterol therapy, another.
That's a big one.
That's a big one.
Everybody's on statin drugs now.
I know, it's really a problem. This is what I call misinformation. the pharmaceutical company create based on science, but the science is not true. What I call is all cooked up science, all in their favor. The cholesterol panel in 1980s, those panel, the physicians are under the pharmaceutical company's payroll. And so depends on how you interpret this data. It's a weak link, the cholesterol and the heart disease. But they push that cholesterol-lowering medications. And 1981, my lab manual says normal cholesterol for somebody who's 50 years old should be around 180 to 310. And now, all of a sudden, after Framingham studies, he said we have to keep our cholesterol level 200 or below. And with so much statin drug that has so much side effects. One of the most things people don't think about is a memory loss. That people, why cannot remember things? Forgetful is actually caused by statin drug.
Goodness gracious.
So first thing I tell them is, stop that statin drug. Then I get a phone call from the family members that if you stop that, my father's statin drug, he may have a heart attack. Because their cardiologist told them to scare them.
Yeah.
That's right.
And it's really a problem. That,
Kate, you see all these miracles walking into the
I do.
to the office. And I mean, it's got to be really encouraging to have people say, oh my goodness, I don't have that anymore. Or this test that you put me through and this, chelation or acupuncture changed my whole body. I mean, that's got to be phenomenal.
Yeah, so as an example, somebody had a heart attack and the cardiologist said, don't eat steak. And when I see him and I check, and I say, your biggest problem is coming from dental problem, and I think they're from the root canal. So I tell him, on your way home, stop by at the grocery store, get your favorite steak, and enjoy it. And when I tell them, because steak did not cause a heart attack, enjoy your steak, your T-bone steak, enjoy it. But make sure you see a dentist and get the root canal up. Wow. That's the cause of your heart attack, not the steak.
Wow.
I mean, he's got a whole,
I got to talk to him.
whole section on dental.
Wow.
Quality of life, that's, I'm getting there, old. Quality of life is important.
That's right.
And that's why I do so many health shows. I think I've done them since 1980. We started in 80, and I've done, I don't know how many health shows. But quality of life is important. But the quality of life that you want to make sure you have is a personal relationship with the Lord Jesus Christ. That is the best life you can ever have. Trust Him today. Oh God, be merciful to me, a sinner. Come into my heart and life. I receive you today as my Lord and my Savior. God bless you. Bye-bye.